Hi Nathan, how are you going today?
Good, thank you.
That's good. So I'm Amy and I'm going to be taking you through your pre-exercise screening today.
Yep.
So the purpose of this is just a series of questions I'm going to ask to get as much information about your medical health as possible, alright? So the reason is for me to do this, to see if you have any complications that might be harmful while you're doing an exercise program. So it could be anything as small as a sore wrist or cardiovascular disease, just anything to do with your health. Alrighty, so once we've determined if there's any contradictions, I'll then be able to determine what exercises you can do in your program and what level of intensity we can work at. Alrighty, so the importance of this is to see if I need to refer you to a doctor first to get medical clearance or anything like that, or if we can go ahead today. So we'll start by going through this pre-exercise program, screening. So the aim of this is to identify if any individual has a known disease or signs and symptoms of disease, see if you're at a high risk or an adverse event during physical activity or exercise. This stage could be self-administrated, but since I'm here today, I'll be able to take that through with you. Alrighty. So, has your doctor ever told you that you have a heart condition, or have you ever suffered from a stroke?
No.
Good. Do you ever experience unexplained pains in your chest, or at rest, or during physical activity or exercise?
No.
Do you ever feel faint or have spells of dizziness during physical activity exercise that cause you to lose balance?
No.
That's good. Have you had an asthma attack requiring immediate medical attention at any time in the last 12 months?
No.
Do you have diabetes, or have you ever had trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told that may be made worse participating in physical activity or exercise?
No.
And do you have any other medical conditions that make it dangerous for you to participate in physical activity or exercise?
No.
Good, that's really good. So you, by answering no to all them 7 questions, you are a low risk client. I'll just get you to sign just down the bottom here. Alrighty, we can now progress to stage 2. Alrighty, so we'll just grab your age.
22.
22, and you're a male. So because you are 22 and a male, that makes you a low risk. You've got no risk factors for participating in exercise today. Have you got any family history of heart disease at all?
No.
No? Awesome. Do you smoke cigarettes?
No.
No, you don't smoke. Describe your current physical activity exercise levels. So are you sedentary, or do you participate in light, medium or vigorous activity? Exercise?
Probably vigorous.
Vigorous, alrighty. And how frequent do you do that?
6 times a week.
6 days a week. And the duration of that?
An hour a session.
Yeah, so that's
Maybe
60 minutes. Alrighty, so overall you're working at well over 150 minutes a week. So that puts you at a -1 risk factor, which is great. Alrighty, and what was your height?
194.
194 centimetres. And your weight?
96.
96.
96 kilos.
Alrighty. So as earlier we worked out your BMI and you were at 25, which is great because that means you are less than 30 BMI, which puts you at a low risk again. So no risk factors there. Have you ever been told you have high blood pressure?
No.
No. Have you been told that you have high cholesterol?
No.
And have you been told that you have high blood sugar?
No.
No, great. So far for this page, we are at a -1 risk factor. Have you spent time in hospital for any medical conditions, illness, injury for the last 12 months? Are you currently taking prescribed medications for any medical conditions?
No.
And I'm assuming you're not pregnant or you haven't given birth in the last 12 months?
No.
Right, and do you have any muscle, bone or joint pain or soreness that is made worse by particular types of exercise? No. Right, so that is really good. So looking back on that, you're at a -1 risk factor. So you are a low risk client, which is great because individuals at low risk may participate in aerobic physical activity exercise up to a vigorous or high intensity. So if we just go back to this table, you're able to see that you're sitting at a high, you can go at a vigorous or high intensity. So you can work at up to, greater than 90% of your heart rate max. And you can work at your RPE is over or greater than 7. So RPE is preserved exertion measures. Also an intensity that cannot be sustained for longer than about 10 minutes. So you can work at a good pace and for a long period of time. Alrighty, so we'll get started and we'll start making a program for you.
Thank you.